Welcome to this week's edition of the Scots in Us and a special spotlight that we are shining on Kids Operating Room, Scotland's leading global health charity. We're going to be joined this week by Dr Maija Cheung. She's the Global Head of Surgery for KidsOR, and she's Assistant Professor of Surgery at Yale University. We are very proud of the American Scottish Foundation to work with KidsOR to amplify their tremendous strides and all the work they do around the world. And so now join me in conversation with Dr. Cheung. Good morning, Maija, and thank you for joining us from Yale this morning to tell us a little bit about how everything is developing with kids operating rooms.
Good morning, Camilla. Thank you so much for having me. I'm excited to be here.
So Maija, you are heading up global operating rooms for kids operating. And in your role, you oversee and help the development of what is now a very rapid growth with KidsOR. Over 50 operating rooms will have been installed within 5 years around the world.
Yeah, that's exactly right. So the ability to upscale KidsOR over the last 5 years has really been incredible. And at the end of this year, we hope to have about 60 operating rooms globally, mostly in Africa, and a couple in Latin America. And we hope to expand to Asia soon as well.
And what does a kids operating room installation mean? How does it come together?
Absolutely. So the local collaborators at different sites, pediatric surgeons around the world, reach out to us and express a need. With that comes an application that we ask them to fulfill, telling us about the cases and what they currently have and who's working there. And then after a site assessment, we determine if that's a great investment for KidsOR to make. We then, using the existing hospital structure, so we don't build hospitals, but we take the existing hospital structure and we install an operating theater as well as recovery rooms and wards. And along with that, we also offer training scholarships for surgery and anesthesia so we can help build up the human resources in the area to enable the operating rooms to really be used to their fullest.
And when we talk about an operating room, it's not just the unit for putting that in, it's about the amount of children that are impacted through being able to come there and their quality of life.
Yeah, the kids, you know, a lot of these kids have conditions that prevent them from going to school, prevent them from interacting with others, some that are almost stigmatized by their communities, and some that are very life-threatening and deadly. And so the impact for the operations in order to provide these children with lives and everything that comes with being a productive member of society along the way is really an incredible impact. And I think that's what drives us all in this work.
And you've been out to some of the operating rooms and been working on the ground out there on occasion?
Yeah, so I was involved since the very beginning on some other projects with David Cunningham, who's the CEO, and then Gareth. I met both of them in Africa before KidsOR was even formed. And so I've been to the places in Uganda that KidsOR has installed. COVID, unfortunately, this past year has really prevented us from being able to travel to a lot of these sites. So our work has had to change significantly over the past year, but I'm headed to Zambia in December to see our 6 ORs there. 6,
that's incredible. And am I correct that there's even a children's hospital unit going into a refugee camp?
There is. We opened the first operating room theater for children in the Kakuma refugee camp in Kenya, which is one of the largest refugee camps. It sees a lot of post-conflict zone refugees, and they have a real significant need because a good percentage of their population is under the age of 18.
And you've been very involved with the Scottish government in also helping with COVID aid, I believe, as well, which is wonderful because it really is still very much an ongoing challenge over there, isn't it?
It is. And, you know, unfortunately, a lot of the promises that were made by high income countries to deliver PPE to our African neighbors have really not come to fruition. But we've been working closely with the Scottish government to deliver about 35 million items to, I think, 9 different countries. So it's been quite a production, and really the credit goes to our Dundee team, who's been instrumental in arranging all of this.
Well, I think we've got so much to thank all of you for. What does 2022, what are you looking to do in the coming year? Are we remaining mainly in Africa, or are we going to be looking to other parts of the world?
2022, hopefully with the restrictions being lifted from COVID, will allow us to travel a little bit more and actually meet up with these local collaborators who we've only been doing virtual visits with soon. So that's really a key part of what we're looking forward to. We're also hoping to expand more into Latin America and even Asia as those projects take off. We've also been working a lot at Kids Operating Room on a variety of projects that are a little outside of the actual installation of the theaters, but really research-based and advocacy-based, so we can try and increase the awareness in the public about what we're doing, and not just what we're doing, but about the importance of health system strengthening and the impact on the global world. I hope that we can catch up with you shortly again. There's so much news happening around this. I'm so proud of what KidsOR is doing, and that the ASF can be a small part of helping amplify the message. And I have to say, your backdrop of what is an operating room for the KidsOR is fabulous. And I know that's one of the whole things to this is also to bring happiness and joy and help the child to heal in all ways. Yeah, I mean, our artwork is a big part of what we do, and that's another project we're working on more this year. You know, kids get stressed out. Everyone gets stressed out when they go to the hospital, but we're really trying to pay attention to those early childhood development, the ability to create calm and a sense of security and joy in the lived environment. And so that's a lot of what our designers do with the artwork. So we're really proud of everything that they've done. Well, I feel joyful as I not only listen to the wonderful things that are happening, but look at our wonderful elephants and giraffes behind us. So thank you. And we look forward to catching up with you soon and hearing more news of the kids' operating rooms. Thank you. Absolutely, my pleasure. Thanks so much, Camilla.